next presentation that we have is on the topic of meaningful conversation, co-creating care records for memory, identity, and accountability needs of care experienced people. And to present that topic, we have Jade Purtell, who is a postdoctoral research fellow at the Department of Human-Centered Computing at Monash University, working on the ARC-funded real-time rights-based record-keeping governance project. What a mouthful. Jade is a transdisciplinary researcher focused on out-of-home care and transitions from care, working across academia and the community sector to promote young people's participation in research policy development and practice. And we also have Lara Gerrand, who is the youth practice lead at Kids First Australia. Lara provides guidance and support to the youth programs within client services at KFA, strengthening the practice skills and knowledge of staff and supporting a practice culture that is evidence-based and ensures their sustainability. We also have Anna, who is a peer facilitator and lived experienced advocate. Anna is passionate about advocating for social justice issues across different sectors like family violence, disability, child protection, mental health, and more. So I'll hand over to you now, team, to kickstart our next presentation. Thank you.
Good afternoon, everyone. I almost lost the mute button. So thank you to the Centre and to Open for hosting this excellent event each year, and what a great session this one has already been. Before I go on, I just want to echo the earlier acknowledgement of country and pay respects to the traditional owners of the lands that we're on. And so myself, Lara, and Anna are here today to talk about the incorporation of young people's voices in systems and service design from three different perspectives: research, policy, and practice. So the Australian Research Council funded real-time rights-based record-keeping governance project is jointly conducted by the Caston Centre for Human Rights Law and the Department of Human-Centered Computing at Monash University. And my role as the research fellow has been coordinating this project on behalf of Professor Melissa Caston and Associate Professor Joanne Evans from IT. And so we've collaborated with Lara and Anna from Kids First Australia and a team of care experienced co-researchers, including Ella Roberts, who wasn't able to be here today, unfortunately. And so Lara and Anna will be able to give practice-based insights throughout this session as to why participatory record keeping is important in supporting voice in work with children and young people. And we'll also share key insights gained through our co-design workshops and reflections on the co-design processes themselves. So I'll just hand over to Lara and Anna to introduce themselves.
Thank you, Jade. So I've already been introduced, but I guess I just sort of wanted to give a bit of background as to how we came to this area. So in 2017, I was involved in the planning committee for Setting the Record Straight Symposium around record keeping and young people in out-of-home care, which really sort of inspired me in my practice around record keeping and participatory record keeping. Through my current work at Kids First and White Lion, after we've merged, we've been looking at case note practice and what that looks like and how to involve young people in that. And we will be developing a client voice framework that will look at incorporating participatory record keeping in the future as well. So I'll hand over to Anna.
Yeah, hi. I'm sort of a youth council member as well. So we're a part of Kids First. And I believe that organisations such as Kids First Australia benefit from youth council and young people's voices through consumer experience, expertise, and feedback for relevance. And I think increasing diverse perspectives. I think it's also increasingly more important to implement the voices of young people and in our research and design to ensure that the things that we are creating, which is for young people, are co-designed by young people for organizations to evolve and improve instead of making sort of assumptions about what young people need. It's recognizing that young people have the skills and creativity to participate and putting lived and community experiences in the forefront.
Great, thank you. So this project was developed to explore systems and governance mechanisms that would enact care experienced and service connected people's rights to not only access their files, but to have those files provide the information that they need to understand what's happened in their childhoods and how decisions have been made about their care. So to look at how we could improve the content of future files and develop regulatory mechanisms that promote participatory record keeping, we developed a co-researcher, co-design model. And for anyone who's familiar with Laura Lundy's space, voice, audience, and influence youth participation model, this rests partly on the UNCRC Article 13 rights to information. So we wanted to ensure that the co-researcher team were armed with detailed research and policy knowledge of human rights and record keeping to complement their expertise by experience. And so 2 of the workshops out of the 5 were very information heavy. And we held an evaluation session to reflect on the co-researcher model, and we offered further self-directed project work, including design of a zine web resource to create an ongoing and accessible legacy of the project's work and the work of the co-research team. So I think I'll skip through pretty quickly on this slide. So this is from the brainstorming workshop, and there was some agreement there about the kinds of rights drawn from the Charter of Lifelong Rights for Out-of-Home Care. There was some convergence around what people thought was most important to young people, and that was what records are made about the child, how information in records will be used or shared with others, and recording the child's view on managing their records, and child-centred, creating child-centred records, and also access to records were of high importance to the team. So many care systems around the world have quite similar conceptions for Article 12 rights to participation in decision-making. And decision-making is often carried out in professionals' meetings. So participation is thought to be associated with these practices. And these quotes therefore represent what might be a simplified overview of the issues that young people may be excluded from or might not feel included in planning processes. A key point to note here is that the co-researcher was asked into their meetings, and then on paper, the care team could report that the young person participated. But having a real say is much, much more than popping into a meeting of professionals who've just been talking about you in private. So this kind of participation can be thought of as procedural tokenism. And then this quote, on the other hand, can summarise what's probably an oversimplification of the solutions to system-centric record keeping. And this quote's from one of the co-researcher team who had a baby while they were living in residential care. And these reflections were a direct comparison between her experiences of record keeping about her life when she was in out-of-home care and the records that she made for her son as his parent. So that's normative record keeping, and that's made from love and care. And our systems practices are often deficit focused and othering, and they can make children and young people feel unheard and uncared for. And so a core feature of care system record keeping is assessment. And this quote here highlights something that's rarely considered, which is how do our record keeping practices create a sense of conceptual permanency about a child or young person's personality, feelings, or behaviour. And so I'm going to hand over to Anna now to talk a little bit about this.
Yeah, absolutely. So I think basically sort of what it comes down to is that having awareness that different circumstances and experiences have an impact on how records are kept about people's mental health, and to recognize the transience of sort of certain circumstances, and the fact that, you know, we need to continuously measure things instead of, you know, one piece of paper to define a person's ongoing mental health.
All right. So positive records reflect young people's voice and story, and it also gives agency to a young person within their own story. And records can reflect the wins and the positive things that have happened, and it allows the young person to know what they have achieved, and for a young person and a worker to reflect together, and for the worker to be able to give positive reinforcement back to a young person. And that can be really, really important, because sometimes they are not able to, you know, they're not already getting that from other people in their own lives already. So to have someone to reflect positive achievements that have happened is really important for young people. And then having multiple perspectives in case notes is crucial for like a holistic and accurate reflection of a young person's experience. If case notes only reflect or only represent the worker's viewpoint, they can be limited or skewed, and they don't necessarily capture the full context of a young person's journey. And engaging a young person and their support networks, including carers, to contribute to case notes really strengthens them. And when case notes only reflect a worker's perspective, it can reinforce the worker's viewpoint as well. So it reinforces whatever the worker is saying is the correct way. So including young people balances that dynamic out. And that can be done through direct quotes from young people, reflections from carers, you know, can be a way of ensuring that happens in practice as well. Go to the next slide. So similar to multiple perspectives, co-creating records with young people can include many different things. The key point is looking at how young people actually want to be involved and whether they want to be involved, and giving them that choice to be involved. But, you know, in terms of practice, how do we actually do that? And I think there's many different ways that can happen. You know, like if a young person wants to include drawings, you know, you can add them to their file while also including case note that provides context so it makes sense, particularly if they request it later on. It's, you know, and it could be your words, but you can also ask young people to use their own words to describe that as well. Making sure that young people know that you're taking case notes from the very beginning, because that's actually really, some young people don't know that they're like who is actually taking case notes, and letting them know that there is a process if they're wanting to access them, but you're wanting to create them with them. So you can ask to create them with them. It's their choice whether they do that. So, you know, but co-writing case notes can involve young people together. So you could write case notes together, like physically sitting together, like writing them on a notebook or on a laptop. You know, you could ask, do you want me to make a record of that? Or what's important for us to include for this session? Or, you know, like, do you want to have a look over what I've written down? Is there anything that you feel like went really well or you want me to capture? And it is really important, just to reiterate, that we include the strengths as well of young people and achievements within that. So we're not focusing on just deficit-based case notes as well. Okay, next slide, Jade. All right.
So some learnings and reflections that I've had is the complexity of record keeping, and the fact that you know, it's important to be mindful of language and unconscious biases when we are, creating notes and approaching this topic. I think that it was really intriguing to see like how different people's lived experiences and perspectives was able to shape, different parts of this project. I think, our objective is definitely to give young people sort of a voice and some agency within, and knowing their rights around sort of record keeping. And that is like sort of further highlighted in, really reinforcing some of the positive things that are involved in record keeping and not just a deficit model, but also just giving opportunities for like two-way communication instead of just the worker having a tick box approach to sort of a tokenistic idea of I've included a young person, I've written it down, and that's done and dusted. So yeah, it's been very interesting.
Thank you, Anna. And by the remuting of yourself, I am moving on to emergency slide number 1. I think we've done such an amazing job of trying to keep to time that we've nearly finished. So what I can do is also show you, so part of this research and the part that we're sort of still currently in is to do interviews with policymakers and researchers about the kind of policy perspective of the implications of what we've learned from the co-design sessions with care experienced young people and service connected young people. So we've done some of those, and this is a reflection from a human rights lawyer here. And this is in relation to Queensland legislation, which an article that's out of the project has sort of identified as probably the most progressive participation legislation for child protection and child safety. And so that legislation says that young people have the right to participate in everything, and they even have the right to not participate, and that they can do that via drawings or recordings or any number of kind of media options. And so that was wonderful legislation. But what it said was that the chief executive of child safety had to make sure that young people knew about their rights. And so this quote is that human rights law perspective, saying there's actually nothing in the legislation to say that the system has to work. It just says that you have to let kids know about their rights, and in this case, a complaints mechanism. And so explaining a complaints mechanism for out-of-home care to a young child or to someone who's dealing with the impacts of trauma and things like that is probably not the best way to ensure that people have access to their rights. So that's that one. And then we also spoke to someone from a statutory authority, and we were talking about documentation and record keeping, obviously. And so they were saying that, usual practice for kind of grievances or legal proceedings or things like that is to document everything. But then you think about a young person in residential care who thinks that they're being discriminated against or something like that. Expecting them to document all of these things is quite unrealistic. So again, are people getting access to these rights? And so what I can do from here is...
Oh, Jade, I was just going to say, like you're welcome to keep speaking, or I have a number of questions that have come in. So up to you whether
okay.
you want to.
Yep, I'll just go to the last slide so that people have got the
perfect.
resources, and then we can go to questions. So there's a couple of articles and things listed there. There's also my email address and Joanne Evans, who's the chief investigator of the project. And so there's a nice quote there about why you would bother speaking with people instead of just about them. But we also have an event coming up for people who are interested. So the Future Directions in Rights-Based Record Keeping for Out-of-Home Care is a research symposium for various record keeping researchers at Monash. And if you're interested in that, you can get in touch with me via my email. And then on the right is the invitation for policymaker and researcher interviews on record keeping issues. So if you're interested in that as well, you can get in contact. Thank you so much for having us today, and I'll let you ask the questions.
Thank you for joining us. This has been incredibly interesting. And I think the level of detail that you've gone into there, for me, highlights that I think Anna touched on this, just the sheer complexity that is inherent within record keeping. And for me, I don't feel like this level of detail was even remotely touched on in any of my formal learning or qualifications. It's been something which, I guess we do need to keep talking about this and looking at professional development and learning to make sure that we are doing, so acting in the best interests of children and young people. As I mentioned, there are a number of questions that have come through. One was a more of a comment, really, and I think Lara touched on this, just saying they've noticed a big increase in FOI requests, makes it so important to reflect all the positives and strengths whilst still maintaining, our own assessment requirements. So yes, absolutely. Another good question here, how do you maintain confidentiality while ensuring that important information is accessible to those who need it, like caseworkers and caregivers? It seems like it's a bit of a tightrope act in getting the right amount and the right types of information. Does anyone have any comments or thoughts about that?
Lara?
Yeah, I mean it is tricky, but I always think that these case notes are a young person's life and file and story, and that there obviously there is confidentiality, but I think it's actually really important that we focus on the fact that we are writing about young people, and that is actually the key point, that we are writing their story. If there are things that you feel uncomfortable about writing, then it's really, you probably shouldn't be writing them, is how I would leave it. I'm not sure if Jade has additional points to that. Thoughts?
I think it is incredibly complex because I'm working with archival and record keeping researchers, but I've previously been a social worker and a practitioner with young people and written plenty of case notes. And I think to reflect everything that you would need to do the best job for everyone concerned is very, very difficult. Fortunately, we are developing some directions for research that might look at how those things could be addressed also. But yes, I would agree. It's very complex. We certainly haven't found the straightforward answers to that. Sorry.
Someone has also asked what policy changes are needed to see these practices taken up across the board. How could we start to really get it out there?
Well, I think this is an amazing time in terms of technology because a lot of upgrades are going to have to happen, and a lot of organisations and government organisations are considering these options at the moment. So at a very kind of high level, simplistic kind of perspective on that would be, we need to concentrate on interoperability and the reducing of double and triple handling. That's a lot of what you hear from practitioners and workers in child protection, is how many times you have to deal with this information, and then how that takes time away from building the relationships that you need with young people to do good work. So getting systems that are built for this kind of work is very difficult because we operate in silos within child and family welfare, but we operate in silos through government and everywhere. So I mean, I'm a social worker in the faculty of IT right now, and I don't really have anything to do with IT because I don't know anything about it. So it's we really, really need to be getting together with people in radically different disciplines to even look at what the needs of different things are, because the best listening software developer or designer or anyone wouldn't have the same perspective or insights as someone who's been in care or worked in care or worked in management of care or all these sorts of things. So we've all got uniquely important insights and they all need to be worked together, I think.
Yeah, absolutely. I think what you're talking there is that idea of like one hand not speak, or one hand not speaking to the many other hands that are, we're all kind of doing this work, but yeah, needing to understand perspective of what it's like for people on the ground and the people who it actually impacts is so important. Someone has just commented saying, this is some really great information. Is there training notes or information sheets being developed for case managers? That sounds like I'm giving you a job. Can you please go and develop some more material for us? Is there anything like that in the works already?
I think there's we're wanting to continue the project because it's obviously early days. So I think this is learnings from the project, which are very important and essential, but I think we're not quite there yet in terms of what this would look like. And I think the important involvement of Kids First allows us to support some of the research in practice and for us to sort of, and with the involvement of young people with lived experience. So we're not quite there yet. That's probably what I would say.
Yeah, I think that's something that because this is a grant-based project, so the grant and the funding will end shortly. And so I think that ideas that we had for looking at other grants would be around developing that sort of thing so that it was available to various organisations. We haven't got to the point of talking about that yet. We've been asked to do it, and we might have a go at that, capacity kind of depending for everyone and the work that they're already doing. But certainly there's a lot of material that's been developed over the years by this research agenda and bringing that all together. Hopefully we're going to do that in the zine and have the co-research team make it much more interesting and accessible information as well. So I hope to have a resource that will be of some use by February, March.
Yeah, fantastic. Thank you. And I know you shared detail just before about that additional event. If you wanted to, do you want to pop the link to register for that in the chat, just in case this has piqued people's interest? They can go along and hear a bit more about that. I'm looking at the time. I think, unfortunately, we are out of time, but I can still see there's a number of questions that we haven't been able to get to. Likewise, questions for the presenters on the other topics and sessions that we've had today. So possibly if there's scope for presenters and guests to have a look at those, we may be able to find a way to get those responses out. Again, not wanting to create work for anyone. It sounds like I'm giving everyone homework. But I think it really speaks to the level of engagement and interest that our audience have had today. So thank you again to all of our speakers. It's been wonderful to have you along and hear about all the different projects that you've been working on. I'd like to thank everyone who has tuned in today, and another big shout out to our wonderful sponsors, VACA, Anglicare, CSNet, Berry Street, Impact Initiative, and WCIG. And that's it for me today, but I wish you all a wonderful afternoon, and yeah, we'll see you again at the next open event. Thank you, everyone.